Everybody back to the Board of Supervisors budget hearings. This is just the continuance of our budget hearings, so we're going to get straight into it. We're going to lead off with introduction of the item from Ms. Mallory Riggs, if you wouldn't mind introducing the Health and Human Services budget item.
I'd be happy to do that. Good morning, Chair Friend, members of the board, Christina Mallory, the County Budget Manager. I'm going to give you a brief overview of the Health and Human Services budget category. So just to let you know, these departments, agencies, and budgets make up the Health and Human Services budget category: child support, core investments, human services, health services, and homeless services. The Health and Human Services category expenditures are approximately $313 million for the upcoming fiscal year. This represents about 40% of the total county budgeted expenditures for fiscal year 18-19, and this represents a 7.6% increase over the prior year. And this is primarily increased costs to maintain current operations and the development or expansion of some programs, including drug Medi-Cal, IHSS, whole person care, and increased support for homeless services. This chart shows the share of expenditures by department and agency, and you can see health services is approximately 54%, and human services is 42%, and that makes up the majority of the funding. The largest expenditure in this category is salaries and benefits, which comprises about $147 million of the total and supports over 1,153 positions. It's an increase of about 18 positions from the previous year, which was primarily added mid-year due to the whole person care program. Additional expenditures include services and supplies of $93 million, other charges of $80 million, and other financing and fixed assets, which make up the remainder of the expenditures at about $8.5 million. The revenues include about $285 million, which represents about 91% of the financing, with the general fund and other funds making up the difference, or about 9%, to meet the expenditure needs. These revenues represent 49% of the total budgeted revenues and are comprised of about $205 million in intergovernmental revenues from state and federal sources, almost $48 million in charges for services, almost $24 million in other financing, and $5 million in the use of money in taxes, and $2.9 million in licenses and permits. Additional financing includes $27.5 million in general fund contribution and less than $1 million in other funds. This chart shows the share of financing by department and agency, and note that core investments are not represented as they are totally supported by the general fund. And here you can see the general fund contribution by department. It's approximately $27 million. Represents about 19% of the total general fund net cost, and further details will be provided in each of the department budget proposals. So we'd like to end on a high note and give you some highlights and successes. As noted yesterday, there are still some critical unmet needs in the health and human services arena, including services for the homeless population, including the Navigation Center, year-round emergency shelter, behavioral health and substance use disorder treatment, and permanent supportive housing needs. However, we'd like to leave you with just a few of the accomplishments in health and human services this year. Serving our most vulnerable population, emergency shelter capacity increased by 30%. And new on-site health care and benefits enrollment services were offered at these shelters. Addressed over 22,000 communicable disease incidences and provided over 400 home visits through the Nurse-Family Partnership, and supported veterans through increased outreach and reduction in wait times for benefits appointments. The majority of the Health and Human Services budgets will provide more information on the regular agenda. Child support is listed on the consent agenda as a status quo budget proposal. And Jamie Murray, the department head, is here today if you have any questions. And that concludes my presentation.
Thank you for that introduction. Are there any brief questions before we move on to the consent agenda? Okay, seeing none, we have one item on the consent agenda, which is to approve the 2018-19 proposed budget for the Department of Child Support Services. Are there any questions or comments on this item? Is there anybody from the community that'd like to address us on the Department of Child Support Services before we go into our regular agenda? Okay, seeing none, we'll bring back to the board for action.
I would move to adopt the consent agenda and thank Child Support Services for the good work that they do.
Second.
We have a motion from Supervisor Leopold and a second from Supervisor Coonerty. All those in favor? Aye. Opposed? It passes unanimously. We will now move on to the first item of our regular agenda, which is to consider the 2018-19 proposed budget for Homeless Services Coordination, including any supplemental budget materials as provided in the referenced budget documents. We have the FY 17-18 goals and accomplishments, the Homeless Services Coordination FY 18-19 proposed budget, and the 2018-19 supplemental pages. Good morning and welcome.
Morning. Good morning, Chair Friend and members of the board. I'm Rayne Marr, the Homeless Services Coordinator, and today I'm bringing before you the proposed budget for Homeless Services Coordination. With me this morning is Assistant CAO Elissa Benson, who has recently joined our team and is providing a tremendous amount of support around this issue. Before I begin my presentation, I would like to extend my immense appreciation to our many nonprofit providers, the faith community, and our local jurisdictions for their excellent work, partnership, and support in our collective efforts towards addressing homelessness in our community. I would also like to extend a special thank you to our County Administrative Office, Human Services Department, Health Services Agency, Planning Department, Probation, and Sheriff's Office for their support and partnership as we have been working towards recalibrating our internal efforts. Their talented leadership and staff have provided invaluable guidance at the policy level, and their staff is providing services with both professionalism and compassion. This morning, I'm going to provide you with an overview of the various elements of coordination our office is leading, 2017-18 goals and accomplishments, the proposed budget, 2018-19 goals, and unmet needs. My role has been very systems level, engaging with all of the necessary people and organizations that are working on this issue to collaborate on implementing system improvements and expansion, to bring new resources to bear, and to drive systems change, all with the ultimate goal of reducing homelessness and assisting our unsheltered residents into permanent housing. The 2017 point-in-time count tells us that we have 2,249 homeless people in our community at this time. 80% of those, or 1,800, are unsheltered. Of those, 36% are living on the street. 30% are in a vehicle, and the rest are in abandoned buildings or encampments. Most profoundly underserved is our youth population. 98% of them are unsheltered. On the Youth Advisory Board, I've met a number of young people. One of them is a full-time student at Cabrillo and working full-time at the same time, and he can't afford housing, so he lives either in a tent behind the college or sometimes sleeps in his car. Another one wanders the street at night trying to stay awake because he doesn't have a safe place to sleep. Within our county family, I get calls from folks in various departments. They're calling to ask how can they help the mother that they know who's sleeping in a car with her children, or the senior citizen who is about to lose their housing and is on the brink of homelessness. The need for emergency shelter and affordable housing in our community cannot be overstated. Homeless Services Coordination staff consists of one full-time Homeless Services Coordinator, that would be me. Additionally, since January, Elissa has been dedicating about 50% of her time to this issue. Our county does not have a formal office of homeless services, and historically we've had a very decentralized way of addressing this issue. There's been no collective county voice on the issue, nor an internal forum to strategize, execute, and operationalize. This has been our first year to do things differently. Over the past year, internal efforts have focused on recalibrating in order to organize and leverage our existing resources for a more collective impact, bringing together the key department heads and their top staff to create, in essence, a virtual Office of Homeless Services. The result of that effort is a new County Homeless Coordinating Committee. These 18 key county leaders are now working together, tackling tough policy issues, planning for the future, and figuring out how to recalibrate our efforts to maximize our effectiveness. Our goals include advising your board on policy issues, planning and evaluation, coordinating operations across departments, and giving a new focus to equity and access to services across the county. 3 working groups have been formed and are actively engaged with implementing SmartPath coordinated entry within the county departments, developing a robust communications plan to articulate the county's response to homelessness, and pivoting towards outcomes-focused contracting for homeless services. I would like to thank the directors and their staff for their leadership, guidance, and support, and ask that those members of the committee that are here today please all stand and be recognized at this time. And thank you. Earlier, I talked about engaging with all the necessary people and organizations to implement service improvements and expansion.
We're missing a slide.
This happened.
We're missing one slide.
We're missing one slide.
She will just speak to it.
This happened yesterday when we were doing a run-through. I don't know why. To bring new resources to bear and to drive systems change. What you're missing is a visual representation showing various spheres in which our work is going on. That includes South County, youth homelessness, leading the Homeless Coordinating Committee internally, working closely with various homeless services providers, working in South County, and so forth. Over the past year, extensive collaboration has taken place with a wide range of these partners on implementing coordinated entry, establishing shelter programs, integrating mainstream resources with shelters, expanding services and funding for South County, and providing leadership and support related to the Youth Homelessness Demonstration Project and the Youth Advisory Board. Our nonprofit partners and the faith community are the boots on the ground. They're the ones that are actually changing lives every day, and the work that we do is in service to theirs. And if there are members of these initiatives or others engaged in homeless services here in the audience today, would you please stand and be recognized? Thank you. They're doing important work. In the 2017-18 proposed budget, we set these goals for ourselves, consistent with the all-in plan. 2017-18 saw introduction of new programs, services, and funding for South County, approval of projects for the $2.2 million HUD grant, and the launch of SmartPath coordinated entry. Significant progress has been made, and good work continues with both supporting the HAP and improving our governance structure. Over $3 million in new funding was secured through a variety of grants. The budget cover letter provides an overview of these goals and accomplishments, and the supplemental budget provides an in-depth discussion of each. As the year progressed, new goals emerged, and so I would like to take a moment to highlight some additional key accomplishments. We worked on system-wide improvements that included developing new models of delivering services and expanding capacity. We integrated county services into existing shelter programs. Our Health Services Agency introduced the new HOPES model, which you'll hear more about in their budget presentation. In support of shared systems, the supplemental budget includes a recommendation to transition the SmartPath Coordinated Entry Lead Agency from the Homeless Services Center, who launched it, to our Human Services Department, where it will be stabilized and supported for ongoing operations. Planning for this transition has been a vital part of ensuring the stability and sustainability of SmartPath. In addition to internally recalibrating how we are coordinating and delivering services here at the county, we also launched an internal review of how we are organized around homeless services functions and operations. We successfully secured numerous grants for homeless services and also secured critical one-year funding for ongoing operations and sustainability of SmartPath. The proposed budget provides for one full-time staff position, the county's share of cost for the emergency winter shelter program, and the new Homeward Bound program that will launch this summer. While this budget includes staffing costs for my time, it does not reflect the staffing cost of our Assistant CAO, Elissa Benson, nor of the members of our Homeless Coordinating Committee. It also does not reflect the county's substantial investment in homeless services, which includes shelter, housing, and a wide range of supportive services. The county's significant investment in homeless services funding can be broadly categorized in 3 areas. Administration, in addition to what I've already described happening out of our office, includes planning department staff providing oversight for HUD continuum of care operations. Shelter and housing includes emergency shelter, sober living environments, transitional housing, and permanent supportive housing. Supportive and stabilizing services includes a wide range of things, including homelessness prevention, housing navigation, case management, rapid rehousing, employment training, and other key supports. What's not included here are substantial expenditures on mental health and substance use services or entitlement benefits such as general assistance, CalWorks, and CalFresh. Those are very difficult to estimate as to which portion of those benefits are being provided to homeless people. 2018-19 goals are grouped in 3 categories, but all of them map to the all-in plan. We will continue to build off of the planning work that has already been underway and completed to date. We will open new navigation centers in North and South County and develop project plans for emergency bridge housing. We know we need to continue to expand services for this population, including substance use treatment, mental health services, and we plan to test new models to reach those who are hardest to serve. As we transition SmartPath lead agency to the county, we must support and sustain it, and we will implement SmartPath intake and assessment processes in all county departments and divisions where substantial numbers of homeless people are being served. We will analyze the effectiveness of our current investments and evaluate if we have the right mix of programs and services. We will complete our internal analysis of organizational effectiveness, and we will develop aligned outcomes across housing and homeless services contracts and continue to improve data quality and consistency across programs. We will also continue to seek new sources of funds. Despite progress, we have significant needs. There are few sustainable sources of funding for homelessness. An estimated $1.5 million in emergency sheltering costs for fiscal 18-19 will only address about 10% of our total shelter need. We will still have substantial unmet needs for year-round shelter throughout the county, including population-specific services for seniors, women, and youth that are as yet unaddressed. We still need a substantial supply of supportive housing to move homeless people into. Shelter is only an interim measure. On a one-time only basis, we anticipate emergency block grants from the state. This will solve some of our short-term funding needs to address homelessness, but it doesn't resolve the issue or the need for long-term sustainable funding. With a crisis level of homelessness in our community, state, and nation, we have a lot of work to do. And we are challenged every day to reevaluate what we are willing and able to do to address it. The partnerships we have forged, the systems changes that we are making, and the innovations we are testing demonstrate our community's commitment to solving this complex problem. I would like to thank your board for your commitment to this issue and your support for the work of this office. With that, I would ask that your board adopt the proposed Homeless Services Coordination budget as recommended, including the associated items in the supplemental budget for the Human Services Department and Planning Department to transition the lead agency for SmartPath from Homeless Services to the county. And this concludes my remarks, and I would be happy to take your questions.
Thank you, Ms. Marr. Are there any questions from supervisors? Supervisor Leopold.
Thank you, Chair. Thank you for the presentation, and thank you for the ongoing work. Just had a couple questions. With the SmartPath assessment, the supplemental showed that there were about 119 assessments completed. but we know we have lots of folks accessing services. What's the expectation of when we will have the over 2,000 people who are homeless as part of this system?
We don't have a set date by which we think we can have everyone assessed, but as of yesterday, we had 160 trained assessors in the community, and we're still training more people. And, our goal is to have what's called a by-name list, so that we have a sort of takedown list, if you will, of all of the people that we can identify who are homeless. We're able to prioritize them for the, services that we do have available. And we're working very aggressively, kind of like when we rolled out, the new Affordable Care Act, and we did very intensive enrollment. We're attempting right now to do very intensive assessment. So as soon as we can, but, we're working on building it out.
Yeah, well, it seems very important to get people into this system so they can access all those services. The other question I had was the winter shelter and the capacity at 87%. Given that we know that we have so many people unsheltered, is there discussion about strategies in order to increase the number of people who use the shelter services when we have them available?
Yeah, I think this year we're looking at a change of the model from a winter shelter model to a year-round model, and our focus is on a low-barrier system. We want to be able to accommodate, couples, people with dogs, and, those are some of the reasons why people don't go. Having population-specific shelters could also help in the long run because, for example, many women, especially women who've suffered trauma and abuse, won't go to a shelter. Youth won't go to a shelter that's designed for adults. So, we have some very specific needs, and until we can address those, I think we'll still see some underutilization. The only times we see full utilization of the winter shelter is on the coldest, wettest nights. So.
Right. Thank you.
Supervisor McPherson.
Thank you, Chair. I just want to, first of all, thank those who were in the audience that stood up, and the coordinated effort. I've never seen anything like this, and this is our most pressing and complex problem we have in this county, probably, overall, along with housing in general. And I think the same holds true for the state of California. This new problem, relatively, it seems like it just exploded 5 years ago, or maybe a little more, but it's throughout the state of California and everywhere. I just want to thank in particular, the faith community and the nonprofits who have come to the table. We're well aware of this very, very pressing problem, but you're right there with us, and we can't do this without you. So I just want to say how much I appreciate what you're doing for us. I don't think there's an example of a more coordinated effort trying to solve a huge problem that we've tried to address in Santa Cruz County since I've been here for 5+ years now. I just, with the state, it has also been, it's evident from the state budget that was just passed to be signed by the governor. They have really put a lot of effort, a lot of attention to the homeless problem in the state of California. What in general, how much in general does that mean for us? And I think with the program that we've outlined, it seems like we're in good position to get any kind of a matching grant that might be available. I don't know if there's something out there that you say we're in good position to get more funding for some of these programs. In general, I know the budget just passed, so do you have any kind of a calculation, or is there more out there that you're hopeful that we may be getting aside from what's being presented here?
There's no specific other grant that we're seeking at this time, except for the No Place Like Home grant, which is going to be going on the ballot in November. And I don't think that we would be able to use this as a source of match for that. But having a source of match is extremely important. It is often the case that, there are grants out there that require match, and if we have a ready source of that, that'll make it much easier. And, we're always looking for every possible source of grant funding that we can get. And we will continue to do that.
And aside from thanking the faith community and the nonprofits who have helped us so much, I want to thank the city, particularly in the city of Santa Cruz, who we've worked with, and this year-round shelter is absolutely necessary. It's really troubling to see how many children are minors or are facing homelessness as they are. But I want to thank you and Ms. Benson for getting a focus on what we need to do and the direction we need to go. This is going to be a long process, but we're well on track, and I really appreciate what you have done with cooperation from others in our community. Thank you.
Thank you, Supervisor McPherson. Supervisor Coonerty.
Thank you, and it's amazing to see both the coordination within the county and then externally. It's been missing for a long time, and I think we're starting to see real benefits from that. And I appreciate that when we look at the staffing of one, that while everyone else is putting in a lot of time and effort, trying to coordinate and all these programs is great. In terms of the goals, I mean, Supervisor Leopold just asked about the coordinated entry system. When we did the ACA rollout, we knew exactly how many uninsured there were. There were annual goals. We had to meet those goals. Systems were changed. Can we do the same thing? I mean, what a lot of these goals are missing is the number that's going to be provided at the end of when we come back here next year. How many coordinated entry? How many people will be through the coordinated entry system? How many people will be left? What's the mandate? And so what can we do to get better numbers around some of these goals?
We can do a better job of getting the numbers. We can, it's one of the things that we really want to do this next year is focus on data and evaluation and setting those targets. I don't believe there are any set metrics yet, but that's a very good suggestion that we should do that. There are reports being developed right now that will allow us to pull the information we want out of the new coordinated entry system. They're being worked on as we speak. So being able to get those metrics of how many people are being assessed, what's their outcome, and so forth, that's data that we don't have now or haven't been able to get up until now. So we will be doing that, and I think having very measurable goals and having data that we can measure that from is a key part of what we want to do going forward.
I'd like to add to that a little bit. I think one of the key benefits of the transition of the lead agency role to the Human Services Department is their strong capacity in using data and creating systems. As we were looking at options, recognizing we need that organizational backbone to really support this kind of program, that definitely fed into the recommendation that's before you today.
Yeah, thank you. And I trust HSD. I've seen their dashboards. They're great. And I think, and just for all the departments, but specifically around this is, as we put numbers to these goals, my expectation is not that you're going to hit every number every time. And I imagine my colleagues don't plan on, waiting till next year and then berating you for not hitting. I expect that some of the goals will not be met because federal funding starts to shift, or there's a new need, or we just set a really ambitious goal and couldn't quite get there. But I think having those numbers would be helpful because then we know what's working and what's not. And that's the second part, which is I think the overall goal still has to be to reduce the number of homeless in our community and have that be the goal and that be tracked. And then understanding, as Supervisor McPherson says, that this is not just this is not a phenomenon that's happening locally, it's happening statewide, and it's happening nationally, is even if we have comparable counties, even if our rise is slower than their rise, then we know we're on the right track. But I think having that goal and then having some comparable counties so we can see, well, what are they doing that may work, or what are we doing that's working better than them? I think that has to be the goal that then drives all the other goals going forward. So I'd be interested in that going forward.